Now, live from KUSI, this is Good Business San Diego. Sponsored by Wilsey Asset Management. Hi, I'm Robertson. Welcome to Good Business San Diego, where we talk to the small business owners, entrepreneurs, and community leaders that are serving the people of America's finest city. Today, we welcome Dr. Amar Patel. He's a board-certified nephrologist who specializes in treating kidney-related diseases, including hypertension and electrolyte imbalances. And he provides services including dialysis treatment, too. Dr. Patel is the director of Balboa Care at Balboa Nephrology in the South Bay. And today, we'll learn about his team's dedication to patient-centered care to improve the overall healthcare experience. I know you've spent a lot of time working on this and very well reviewed, I must say, Dr. Patel, so congratulations on that. Tell us a little bit about the history of Balboa Care. It's a big practice, right?
Yeah, well, first, thank you, Roy, for having me on.
Pleasure.
Balboa Nephrology has been around for about 50 years, and we serve patients and families in San Diego County, Imperial County, as well as Orange County. I like to think we are a one-stop shop for all things kidney-related, and we've grown over the years to having about 55 physicians and 15 advanced practitioners, so about 65 healthcare providers.
And I was surprised to learn how many patients you're caring for. What's that number?
You know, that changes throughout the years, but we serve about 25,000 patients at any given point in time, and we'd like to grow that number. Part of this month is, you know, National Kidney Month, and early prevention screening helps us take care of more people.
Yeah, we're going to talk about that in just a second here. I also want to point out that you earned national recognition with an industry award, the Exemplary Practice Award. What about Balboa Care makes the experience exemplary?
Well, I think, you know, something that we're very proud of is patient-centered care.
Yes.
We really rely heavily on our values, one of them being patient-centeredness, accountability, respect, being data-driven and innovative. And through those values that we strive to do every day, we are able to take care of our patients and their families and give personalized care as well as the populational health. So important, and so many people just don't have the luxury of that experience, or it feels like a luxury when you do get that experience. So nice to know what it is that you're doing to focus on the patient. That goes into the physician visit, from coming into our front office with a smile. Times are tough when you're dealing with illness, especially chronic illness, and for our population, a lot of them have multiple illnesses that kind of could go together, whether it's diabetes, hypertension, and kidney disease or heart disease. And having a nutritionist on staff, as well as peer mentoring programs through our partnerships with Remend and organizations like that, we really think we are doing a great job serving our population.
Excellent. So you mentioned this is a National Kidney Month, and this is all about raising awareness and, of course, taking action, too. So what are some of the early symptoms or some of the other related conditions that may suggest kidney disease?
Yeah, that's a great question. I think first and foremost, whenever you're seeing your primary care physician, one of the common tests they order will include kidney function panel as well as urine tests. Conditions like high blood pressure, diabetes they go hand in hand with kidney disease. And so if you have any of these conditions, definitely checking your blood work as well as a urine test to see how things are and what may or may not need to be done to see a nephrologist or a kidney specialist.
But the screening that you have done just as part of a routine physical is going to give you the information about potential kidney disease or related issues. So really the most important thing is just to stress going to get that routine physical done, right?
Yeah, that's spot on. Going to see your physician, a general practitioner, is the first step. To getting screened for possible kidney disease.
Okay, good information. Thank you very much for being here today, Dr. Patel. Really appreciate it. More information about the practice online by going to balboacare.com. And we'll be right back with more of Good Business San Diego.